All right, gang, we're cruising. Movements, muscles, done for the week. So knee flexion, I think all you guys know this already, but essentially it's bending or decreasing the angle between the femur and the leg. So we're going to actually be pulling the ankle back closer towards the butt. Extension is going to be flipping and reversing it, right? Like just Missy Elliott style. We're going to be taking and bringing the knee into a straighter position. So we're actually going to be extending or increasing the angle of the joint. We're also going to have internal and external rotation that's going to occur when flexed or slightly flexed. So if you look, you can have internal rotation, bringing it towards the inside, right? Rotating the tibia inside. And then we can also have external rotation, rotary movement outside, moving the tibia away, moving the leg laterally away from the midline. Neither one of these is really going to occur unless you have that slightly flexed position. That's why I told you earlier to actually lay prone on the ground because it's a little bit easier. I don't know. I have terrible single leg stability. So major muscles associated with the knee. On the anterior side, anterior compartment, we're going to be producing extension, right? So we're going to have our quadriceps muscle group. Main job is going to be extending the knee. If you remember closely, or if you remember, I guess you wouldn't remember closely. If you remember correctly, there it is. Some of the quadriceps are actually going to span the hip joint as well. So they're going to also be hip flexors. Hint, hint, rectus, femoris, right? Largely quadriceps means four. So it's going to be four muscles. We're going to have the rectus femoris, which is going to span the hip joint and the knee joint, making it biarticular. We're going to have the vastus intermedius, which you can't really palpate because it sits below the rectus femoris, and that's why it's kind of got this like weird little cutout. We're going to have the vastus medialis or the vastus medialis oblique, VMO. And we're also going to have the vastus lateralis, which is going to run along the outside of the quadriceps. So the Q angle or the quadriceps angle is basically going to be a line of pull that is drawn from the ASIS to the center of the patella. And that's going to be the line of pull for the quadriceps, right? So it's going to actually be at an angle because the femur is sitting at an angle. It's not straight up and down. If you look closely at these figures, you can see that that femur is not sitting directly vertical. The other line that we're going to draw is we're going to draw a line straight vertical through the patella. And that's going to be a line of pull from the patella to the tibial tuberosity. So the smaller that angle, the less likely, or the smaller the angle, the less of a Q angle. The higher that angle, the greater the Q angle, right? And what a larger Q angle does is it predisposes you to certain knee pathologies or certain knee conditions. One of them is actually increased risk of ACL tears. So this Q angle is actually more common, this greater Q angle is more common in females than it is in men because females tend to have wider hips. So it actually is going to generate a wider Q angle because the femur is going to be drawn in at a higher angle. Another term for this is basically valgus, right? So it's putting the knee into a more valgus position. So the greater that valgus, the greater the Q angle, the more likely we are to have knee injuries. On the back side of the hamstring, on the back side of the knee, or on the posterior compartment, we're going to have the hamstring muscle group. Predominant for the back or the posterior compartment is going to be knee flexion, right? We're going to be pulling that tibia or that shank backwards. It's going to be consisting of three major muscles. We're going to have the semitendinosus, semimembranosus, and then the biceps femoris. Remember, biceps means two heads. We're also going to have the popliteus, which is going to help kind of assist the medial hamstrings in some of that internal rotation. Kind of like you have an arm pit, you kind of have a knee pit, and that knee pit is the popliteal. Discussion of the hamstrings, what we really need to kind of talk about is what two joint muscles are. And the reason is because the hamstrings are going to actually span the hip joint and the knee joint. So they're biarticular. And two joint muscles are going to be the most effective when we're stabilizing one of those joints. So we're either stabilizing the origin or the insertion, trying to help minimize motion and aid in the contraction of that muscle. So what this really is trying to do is help increase the mechanical advantage of the muscle, of the hamstrings, or of the two joint muscles, because we have a couple of two joint muscles. And so what I want you to try to do is actually imagine or even complete how you do a hamstring curl in the gym. How many times do you ever do a hamstring curl where your hips are in full extension, right? So where your femurs are directly below your body and you're doing a hamstring curl. Not very often. Most modern day gym equipments and most realistic hamstring training devices are actually going to put the hips in a more flexed position. And we're going to kind of like anchor the hip by going into that more flexed position, which will allow us to maximally address knee flexion and target that hamstring muscle. So all that to say, it was super wordy. All that I was trying to say with this is that we need to help secure one muscle or the other. We need to help secure the origin of the insertion in order to get the maximal efficiency of the movement. So just to review, anterior side of the leg, an anterior compartment relating to the knee joint, we're going to have knee extensors. Posterior compartment, we're going to have predominantly knee flexion. We're also going to have a little bit more, but predominantly knee flexion. So if we're talking about the quadriceps, if we're talking about the anterior compartment, we're going to be talking about the key muscles, right? So when we jump, we're going through something called triple extension. We're extending at the knees, we're extending at the hips, and we're extending at the ankles. We're plantar flexing at the ankles. But regardless, the quadriceps are a key muscle when it comes to jumping. Additionally, our quadriceps are a very crucial muscle when it comes to decelerating, changing speed in multiplanar exercise when coming down from a jump or when sitting down, right? Think about the motion that you go through as you're sitting down. What are you doing? You're going into a flexion position, but you're using gravity or you're using an external load. So what your quadriceps are actually doing is eccentrically contracting and decelerating that load. So our quads are incredibly important. They are vital. Our quadriceps are going to all attach to the patella. They're all going to attach to the superior portion of the patella and then to the tibial tuberosity via the patellar tendon. So we're going to kind of like insert into the patella, and then that patella is going to be tied into the tibial tuberosity via the patellar tendon. They're all palpable except for the rectus femoris, or except for the vastus intermedius, because it sits directly below the rectus femoris. We can actually test strength and power of the quadriceps by doing a vertical jump. Great example of how you test quadriceps. Squats as well, right? There is a level of need for strength in the quadriceps. So if your quadriceps are weaker than your hamstrings, you're at a predisposed risk of knee injuries. It actually increases your risk of knee injury. But if you are able to have quadriceps that are 25 to 33% or substantially stronger than your hamstrings, you actually are going to decrease the likelihood of those knee injuries. You're actually going to secure the knee quite a bit more. You're going to make that knee joint a little bit more stable. So let's talk about the rectus femoris, right? Responsible for flexion of the hip, extension of the knee, and anterior pelvic rotation. If we lock that knee in, and we lock the knee in extension, and we contract on the rectus femoris, we're going to actually take and tilt our hips forward, right? Anterior pelvic rotation. Flexion of the hip makes sense. Raising up that leg, extension of the knee, swinging out the ankle away from the body. We're going to originate on the anterior inferior iliac spine, as well as on the groove of the posterior side above the acetabellum. Okay, so we already talked about rectus femoris when we were talking about the hip. Now let's talk about where it's inserting. It's inserting on the superior aspect of the patella, like all the quads, and then that patellar tendon is going to insert into the tibial tuberosity. So it's running along the length of the femur. Our vastus lateralis is going to be responsible for extension of the knee. It originates below the trochanter on the femur and on the anterior and inferior borders of that greater trochanter. So what this means is it's originating on the outside head of the femur, or on the outside trochanter of the femur, right? So kind of like directly opposite of the head of the femur. It's going to run along the lateral border of the quadriceps, or of the femur, and it's going to insert on the patella, which is going to insert it's going to insert on the patellar tendon, which inserts on the patella, which inserts into the tibial tuberosity via the patellar tendon. It's going to be responsible for knee extension. Vastus intermedius, same story, extension of the knee, except it is going to originate on the upper 2/3 of the anterior surface of the femur. Huge origin point. It's going to insert patella, patellar tendon, tibial tuberosity. Vastus medialis, again, extension of the knee, origin, whole length of the linea aspera, so it's just on the anterior side of the superior portion of the femur. It's going to insert on the patella, patellar tendon, tibial tuberosity. Got that. Now, what about the hamstrings? This is where things get fun again because they are two joint, right? Hamstring muscles are going to be comprised of semitendinosus, biceps femoris, and semimembranosus. If you look here, the semitendinosus is largely going to be in the middle. Semimembranosus is going to be towards the medial aspect, and then the biceps femoris is going to kind of sit more towards the lateral aspect. So the semitendinosus is going to be responsible for flexion of the knee and extension of the hip. Right? Makes sense. It's also going to be responsible for internal rotation of the hip, internal rotation of a flexed knee, as well as posterior pelvic rotation. So we're going to actually go into posterior pelvic tilt with the help of the semitendinosus. It's going to have an origin on the ischial tuberosity all the way down on the bottom of the pelvis, and it's going to actually insert on the anterior medial surface of the tibia. Right? So think that through. We're actually going from the posterior, wrapping around to the anterior side. So that's going to be what is responsible for that internal rotation because that line of pull is running from posterior to anterior. So it's going to help rotate that femur. Semimembranosus, again, flexion of the knee, extension of the hip. Again, it's going to be internal rotation of the hip and internal rotation of the flexed knee. And let's look at this again. So this is going to be the ischial tuberosity and inserting on the posterior medial surface of the medial tibial condyle. So it's going to run from the posterior side of the ischium and then insert on the posterior medial surface. So it's going to, the line of pull is not going to be as great as the semitendinosus for internal rotation, but there is still going to be a level of internal rotation occurring. Biceps femoris, again, you're starting to notice origination on the ischial tuberosity, but it's also going to originate on the femur. Remember, it's got two heads, biceps femoris. It's then going to insert on the lateral condyle of the tibia and head of the fibula. So what does that mean? It means it's going to be responsible for flexion of the knee, extension of the hip, external rotation of the hip, and external rotation of the flexed knee. Because the line of pull is coming this way, right? So we're actually going to rotate the femur outwards. Our TFL, we talked about this when we were talking about our hip, but this comes into play again here with the knee because we're actually going to cross the knee joint. It's going to be responsible for abduction of the hip, flexion of the hip, lateral pelvic rotation, as well as an external rotation of the knee. Check, right? So we've already covered TFL when it comes to the hip. All we're doing is we're adding one new step, and that's going to be external rotation of the knee. And if we think about it, it's originating on the anterior iliac crest, and then it's actually going to be inserting a fourth of the way down on Gerdy's tubercle. So if it's inserting on the anterior iliac crest, it's going to insert on the anterolateral side of the tibial condyle, or Gerdy's tubercle. The popliteus, remember, it's going to sit in that knee pit, if you will. It's going to be responsible for flexion of the knee. It's going to cross directly across the knee joint and some internal rotation of the knee as well. It's going to run along it's going to originate on the posterior surface of the lateral condyle of the femur and then insert on the posterior medial surface of the tibia. So it's going to actually cross. And by allowing that to kind of run from outside to inside, it's going to allow for that internal rotation of the knee. So that's it, guys. That was the knee. There's not as much going on here, a lot less musculature, a lot less kind of occurring, a lot less joint motion, so it makes it a little bit easier. Do your best. I know you guys are going to do great on the exam, all that type of stuff. Rock on.